Hello, everyone, and thank you for joining this webinar on Opioid Settlements 101. My name is Chelsea Kelleher, and I work for Aurora Health Group, and we are helping DHCS facilitate today's webinar. Next slide, please. During this call, if you have any technical difficulties, please send a direct message to Abina Asari from the Aurora Health Group team, and she can help you troubleshoot the issue. Today's webinar will provide an opportunity for questions. Questions can be submitted at any time via the Q&A feature on your Zoom control panel, as well as at the end, we will be taking verbal questions as well. The webinar today will be recorded and posted to the DHCS OSF, our Opioid Settlement Fund's resources page, and we will share that link via email as well. Next slide. Today's webinar is intended to provide the basics about the opioid settlements and is intended for new staff who may have missed previous webinars or anyone who wants a refresher. During today's webinar, DHCS will provide background on California's opioid settlements and bankruptcies and their governing agreements. DHCS will also review allowable uses of funds, reporting requirements, and helpful resources. And finally, there will be an opportunity for Q&A with the participants. Next slide. This presentation includes a summary of the National Opioid Settlement Agreements, the State Subdivision Agreements, National Opioid Bankruptcy Agreements, and California Statewide Abatement Agreement. In the event that there are any discrepancies, the settlement and bankruptcy agreements, the state subdivision agreements, and the statewide abatement agreement and related court orders supersede this presentation. Next slide, please. I will now turn it over to Jenny Davis from the Department of Healthcare Services, who will walk us through the rest of today's presentation. Jenny is Section Chief of the Opioid Settlements Oversight Section for DHCS, which is tasked with overseeing use and reporting of settlement funds among the cities and counties. So I'll hand it over to you, Jenny.
Thank you, Chelsea. Hi, everyone. Thank you so much for joining our OSF 101 webinar. As Chelsea mentioned, we're going to try to keep it to the basics. This webinar really is intended for those that are maybe new to opioid settlement funds or maybe are newly tasked with opioid settlement funds. And I say that with a caveat that these are kind of inherently a complicated set of funds. There are plenty of restrictions on expending, and we do have a pretty robust reporting cycle for them, but you'll see in future slides, we'll get more into it. But I will do my best to keep it as basic as possible. So first, we will start on the background for California's opioid settlements and bankruptcy agreements. Next slide, please. So here is a very basic overview, basically explaining how we got here and now are in receipt of these opioid settlement funds, both for the state of California and at the local level for our cities and counties. So as I'm sure everyone here is aware, essentially the opioid crisis, which is still ongoing today, but began really ramping up in recent history, which did result in some litigation against some pharmaceutical and drug distribution companies that were kind of allegedly seen to have a negative effect or a fueling effect on this opioid crisis in California. That litigation was ultimately successful, so it resulted in some national settlements, as well as some California state-specific agreements, and then to where we are today, where we are now in receipt of these settlement and bankruptcy funds. Next slide, please. So during the course of what I just mentioned in those settlement agreements, DHCS was named as California's oversight entity. So some of the responsibilities that we have are shown here on this slide. They include monitoring the cities and counties, specifically the ones that are in receipt of those opioid settlement funds for compliance. We have the authority to designate additional high impact abatement activities. And if that is a new term for you, don't worry, we will go over what a high impact abatement activity is. We frequently conduct related stakeholder engagement. And we are also tasked with preparing annual reports. And those reports are fairly lengthy, and they encompass an entire fiscal year of payments and spending, both from the state of California and our cities and counties. We do currently have 2 fiscal years state fiscal year 22-23 and 23-24 published on our DHCS California Opioid Settlements webpage. I'm sure there's a link somewhere here in this presentation. So you can go look at those reports. It'll be a really good starting point to see kind of how the state and its cities and counties are currently spending their opioid settlement funds. It'll also give you a really good idea of how much money is actually flowing into the state of California as a result of these opioid settlements. It is quite a bit. And as I mentioned before, those funds do have some pretty specific restrictions, which we will go into on a later slide. I do like to remind folks that DHCS does not make payments to the cities and counties. All of the payments come from either Brown Greer PLC for the settlements, that's our directing administrator, or it'll come from NOAT 2, which is the trust for the Mallinckrodt bankruptcy. Next slide, please. So here are some questions that we're hoping to answer in the next couple of slides. The first one being which settlements and bankruptcies have been finalized in California, and how much money has California received to date from these opioid settlements and bankruptcies. Next slide. Oh, thank you. I'm going to take a sip of water real quick. As you can see, these are the currently finalized agreements that we have. And ultimately, these are the entities that are making payments to the state of California. So it gets a little complicated in terms of oversight, just because although most of our settlements do follow kind of the same structure, meaning like those state subdivision agreements are almost identical to each other, we do have some other ones that are kind of the exception to that rule. So the ones that we do have full oversight over include Allergan, CVS, Distributors, Janssen, Kroger, Mallinckrodt, which is a bankruptcy, which is why it has that little asterisk there. McKinsey, Publicis, they say states only. I'll get back to that in just a second. Teva, Walgreens, and Walmart. We have McKinsey and Publicis listed here in full oversight, and I know for the folks looking over at no oversight, it also says McKinsey. This is because those are technically two different settlements. So we have McKinsey, which resulted in a states-only settlement, meaning only payments are going to the state of California, meaning it's state agencies and state governments, or sorry, state departments. So that money is only going to the state from that specific McKinsey settlement. It's not going, no payments are being made to the cities and counties. And the same is true for Publicis. So over in the no oversight column we have here, there's another McKinsey settlement, which is the class action settlement. And that one results in only payments being made to our cities and counties and no payments are made to the state. So therefore, the McKinsey payments that some cities and counties may be receiving, there's no reporting requirements to DHCS for those payments. So those inevitably won't be included on the annual report if you are someone that is responsible for reporting on behalf of your city or county. And then we have, of course, the middle column, which is partial oversight. So this right now only includes our endo bankruptcy. This is one settlement that did result in payments being made to the state of California as well as to cities and counties. But inside of that bankruptcy agreement, it did not include reporting requirements or DHCS as the kind of overseeing body. So therefore, we kind of threw it under the partial oversight, meaning we have oversight over the payments that are being made to the state of California, but effectively, we do not have oversight over the payments that are being made from the endo bankruptcy to our cities and counties. Next slide, please. So here's a snapshot of kind of where we are today in terms of how much money California has received. And this is since 2021. I believe our first payment that we included in these totals are from 2021. So you can see we have over $1.5 billion. And to kind of put that into perspective, this might be a little bit of a spoiler, but this is inclusive of, I think, 12 total agreements that have been made. So 12 agreements making payments to the state of California. And in the next couple of fiscal years, we do expect to see 9 additional settlements and or bankruptcies reached their finalization stage, meaning they finished the sign-on process, and they're ready to begin making payments. So 12 settlements have resulted in $1.5 billion over the past 5-ish years, and we're expected to get 9 more. Now, granted, some of those settlements that I mentioned in that 12 may have completed payments, some may have been a one-time only payment, but you can see that we are expecting to receive both at the state and the city county level quite a bit more payments coming very soon. Next slide, please. Here is a helpful slide if you are new and you maybe have not ventured to our California Opioid Settlements webpage. We do maintain a courtesy list of payments that have been made to California as a whole. We get this information directly from Brown Greer, who makes the payments for settlements, and NOAT 2, who makes the payments for the Mallinckrodt bankruptcy. So you can go to this webpage and kind of see exactly how much either your city or county has received, or if you're just curious to see, how much variance there is in those payment amounts. But these are actual payments that have been made. And I will say, if you are responsible for reporting, this is essentially the list that we will use to verify when you do report your payments. So it is handy to keep this web page maybe bookmarked, because we do keep this payment list pretty frequently updated as much as we can. And again, those are actual payments. Brown Greer also maintains on their own web page projected payments, so you can kind of see how much is projected to come to California over the lifespan of these settlements. Next slide. So now we'll get into kind of the nitty gritty. Oh, sorry. Oops, my computer just went black for a second. Sorry, hold on 1 second. Okay. Sorry, I'm going to turn my camera off just because that, I don't want that to happen again. So we'll go into the governing documents for the opioid settlements. We're going to start with the state subdivision agreements. Next slide, please. So the state subdivision agreements, these are specific to California. So essentially how these documents came into play were as the national settlements agreements were finalized, inside of those national agreements were the ability for states to essentially structure their settlement allocations according to their own preferences. So California did take advantage of that. So they met with council representing a group of cities and counties and effectively reached an agreement to further define allocations and payment uses for the funds that are going to California. So we refer to these agreements as the state subdivision agreements. Not all states have a state subdivision agreements, but California does, and it does include kind of more specific restrictions and information regarding California, but it works in tandem with the national agreement. So you can think of it as us having two governing documents related to kind of the restrictions and uses of these settlements. Next slide, please. So I think for the folks that are new, these are very lengthy definitions that are essentially pulled from those settlement agreements. But we do have kind of two different sets of what a city or county can be defined as. So the larger set that encompasses like all of our cities and counties, we refer to them as participating subdivisions. That is their technical term that's found in those settlement agreements. And I will say, we do use participating subdivisions and cities and counties pretty interchangeably. It's safe to assume that if we say participating subdivisions and you are working on behalf of your city or county in terms of opioid settlement funds, we are referring to you one and the same. Now, inside of those participating subdivisions, we do have a smaller set of plaintiff subdivisions. And those are the ones that effectively were involved in the litigation that got us here. There is only a handful of them. So not all participating subdivisions are plaintiff subdivisions, but all plaintiff subdivisions are participating subdivisions. And so a really easy way to tell if you're curious, if your city or county is a plaintiff subdivision, if you go to that payment list that we linked on a previous slide, you can see what types of funds are being made to a city and county. And you will likely see abatement and subdivision. So abatement funds are kind of our larger opioid remediation funds that are being provided to all participating subdivisions and plaintiff subdivisions. There is also what we kind of refer to as subdivision funds, which only plaintiff subdivisions get. So if you see your city or county as having received subdivision funds from our payment list, it's safe to assume that you are a plaintiff subdivision. You can always reach out to us. We'll have our email linked at the end. If you're still unsure, we can kind of walk you through that process to figure out if you are indeed a plaintiff subdivision. Next slide, please. Okay, so the next couple of slides, these are the questions that we're gonna hopefully answer for you. The first one being how much is allocated to cities and counties versus the state, and can we use funds for administrative expenses? Next slide. So here is a kind of chart of our distribution of funds. So you can see at the top, it starts with that opioid defendant who is someone we named in a previous slide, like Allergan, CVS, distributor, Janssen. They make payments to Brown Greer PLC, who is our directing administrator. And again, they are the ones that are responsible for the flow of cash, so to speak. From Brown Greer, there is 15% that goes to the state of California via our California State Fund. 70% goes to participating subdivisions as a whole, and that's the California Abatement Accounts Fund. That's the fund I was speaking about previously. That's our larger set of funds for opioid remediation. And then 15% of those funds go to plaintiff subdivisions from the California Subdivision Fund. Now, all of these three different fund types kind of vary in terms of what restrictions they have and the allowable uses. So just really quickly, because we will go through it on another slide, but the state of California, the funds that they received are essentially, they have to be found in Exhibit E or at least be an opioid remediation activity. And those are for statewide projects. Those are the ones that you typically see state departments being responsible for implementing. For example, one of them that DHCS does have is our naloxone distribution project. It typically does get opioid settlement funds appropriated in the budget. And then we have our participating subdivisions, that California Abatement Accounts Fund. Those do have restrictions to Exhibit E. Exhibit E is a list that is found in the national settlement agreements that effectively has pages full of activities that are considered allowable uses. So funds originating from this account type are restricted to Exhibit E. In addition to that, it also has a 50% requirement that those funds received in a calendar year needs to be spent on a high impact abatement activity. And we will go on to that on another slide. And then plaintiff subdivisions, they are not restricted. The funds that they receive from the California Subdivision Fund, those are not restricted to Exhibit E. They're a little broader in its available use. They are restricted to future opioid remediation, and opioid remediation is defined in our national agreement. And they also have the ability to use those funds for past opioid related expenses. And that past opioid related expenses can be reimbursing a past opioid related project, as well as paying for litigation costs resulting from one or more of these settlement agreements. Next slide. Okay, administrative costs. This is a question that we do get fairly frequently. We do have a reasonable administrative cost policy. It's linked right here for when these slides go out. But in summary, for the California Abatement Accounts Fund, which is at 70% of funds, Basically allows for up to 10% of the total amount allocated to a specific project. I know we get a lot of questions on, is it the total allocation of payments? Is it the total allocation in all over the years? But we do define it as the total amount allocated to a specific project. So the 10% applies to the entire allocation for a specific project. You can read a little bit more about that reasonable administrative cost policy in that link. And if you have questions, please feel free to reach out to our OSF inbox. Our California subdivision fund, those funds do not have a specific administrative cost policy, but we do encourage them to follow the DHCS's reasonable administrative cost policy. But if you have any questions, please feel free to reach out. Next slide, please. So of course, like I said, there are more requirements than what I've mentioned. We have put these in some guidance policy documents. We have it linked above here, our behavioral health information notice. This is specific to the California Abatement Accounts Fund. We also have another behavioral health information notice specific to our California Subdivision Fund. But essentially our reasonable and related administrative cost policy, again, shall not exceed 10%. Now there's a little asterisk there saying if the indirect costs, which we consider to be administrative costs, if they are in excess of 10%, we presume them unreasonable, but we may allow them if there is supporting documentation. Interest-bearing accounts, yes, you can put these funds into an interest-bearing account. If you do, you are responsible for reporting that interest, both how much interest was earned on those funds and that those funds must be used for an allowable opioid remediation activity found in Exhibit E. And both of those are required to be reported annually to DHCS. There are expenditure timeframes as well for the Abatement Accounts Fund. Generally, it's 5 years from the date of receipt, or 7 years specifically for capital outlay projects. And then we keep talking about these high impact abatement activities, but we will go into them. But effectively, no less than 50% of funds received in each calendar year shall be used on one or more high impact abatement activity. Next slide. Subdivision funds, a little bit different. We have our bin here linked as well for more information than what I'm going to kind of try to summarize. In terms of administrative costs, again, we encourage those in receipt of subdivision funds to adhere to our reasonable administrative cost policy. You can also put this money into an interest-bearing account, but you will be required to report on the amount that was earned, as well as you must use those funds for an eligible opioid remediation activity. There are no explicit expenditure timeframes in our state subdivision agreements. We do kind of encourage you to follow those timeframes from the California Abatement Fund, just because, you know, these funds are really intended to get out and fund projects that kind of help abate the opioid crisis today, right? Because it's not a future thing that is happening, it is happening right now. And then if you are in receipt of subdivision funds, you do have the ability to reimburse past opioid related expenses, which is unique to subdivision funds. If you have abatement funds, this is not something that is available to you. And those past opioid related expenses can include litigation fees and expenses. And I don't think I've mentioned this before, but if you do take the route of reimbursing some litigation costs with subdivision funds, there is an additional reporting requirement specific to Brown Greer. And we can help you navigate that if needed, but it is on their website. They have a portal for reporting that. Next slide, please. Okay, so settlements that have this structure, we've kind of gone over these before, but these are the ones that essentially follow that 15-70-15 split. So 15% goes to the state, 70% goes to participating subdivisions, and then 15% goes to our plaintiff subdivisions. We do expect additional settlements. I mentioned 9 earlier. We do expect them to also follow a similar, if not identical, kind of structure in terms of how these settlement agreements are laid out. Next slide. Okay. So we went through all of that. Now we're going to do it all again, but specific to the bankruptcy. And right now we technically have two, but these next slides are going to focus more on Mallinckrodt, simply because DHCS does not have the oversight or reporting requirements for the endo bankruptcy. Next slide. So it followed a very similar structure to how we got our state subdivision agreements. Basically, we took kind of the national document and made a specific one that is more in line with what how California wanted it to be structured. Um, Now, these payments for Mallinckrodt have completed. We do not expect any more Mallinckrodt payments to be made. I think the last payment was made in state fiscal year 24-25. So I won't really go into how you get the Mallinckrodt payments, but effectively, whatever your city or county chose in the distributor settlement, it was taken from there, and that's how you were kind of defined in your Mallinckrodt funds. But again, no additional payments are expected. So if you do have Mallinckrodt funds, we urge you to use those quick, just because once you are finished and you have no more Mallinckrodt funds, again, no payments are expected to come from this bankruptcy anymore. It will relieve some of your reporting burden. Next slide. Again, similar to the distribution of funds from our settlements, but from the opioid defendant, who in this case is Mallinckrodt, make payments to the National Opioid Abatement Trust, which then makes payments to the state of California or our cities and counties. And specific to this agreement, they do call them local governments. But in our eyes, local governments are essentially the same things as participating subdivisions in terms of the funds that they receive and kind of how they're set up against the state. Both of those fund types are restricted to, it's Exhibit 4 in the Mallinckrodt bankruptcy plan, but Exhibit 4 is identical to Exhibit E. So if I mention anything about Exhibit E, you can assume that's going to effectively have the same advice for Exhibit 4. Next slide. Mallinckrodt funds also can be used for administrative costs. They do explicitly cap it at 5% of the total allocation. This is found directly in that statewide abatement agreement. So there is less wiggle room in this 5% than we've kind of implemented into our reasonable administrative cost policy, which is 10%, potentially higher if there is, some justifiable supporting documentation with it. Next slide, please. Here are some additional expenditure requirements. These are specific to the local governments, who are basically the cities and counties that are receiving Mallinckrodt funds. We do have an opioid bankruptcies fact sheet that's going to kind of summarize a lot of what we talk about here in regards to Mallinckrodt. You can also review the actual statewide abatement agreement, which is also linked here. So for reasonable and related administrative costs, again, it shall not exceed 5% of the total allocation. Interest-bearing accounts, yes, you can include Mallinckrodt in an interest-bearing account. That interest earned does need to be then used for an eligible opioid remediation activity, something you can find in Exhibit E. Expenditure timeframes. Mallinckrodt doesn't have explicit expenditure timeframes, but we do recommend that if you still have Mallinckrodt funds that are unexpended, probably following the expenditure timeframes for the abatement accounts funds is recommended. And the faster you use your Mallinckrodt funds on an opioid remediation activity, it's just going to mean less reporting to DHCS, which I would think sounds like a good thing. And then allowable expenditures, they are required to be used on activities that are aligned with those in Exhibit 4. And again, Exhibit 4 is identical to Exhibit E of those national settlement agreements. Next slide, please. So also on our DHCS California Opioid Settlements webpage, again, we do have a fact sheet specific to the California opioid bankruptcies. There may be more coming if they follow the same structure as the Mallinckrodt bankruptcy. We are a little unsure. It's expected that the allocation structure will likely remain the same, but those bankruptcies are a little bit different than our settlement agreements, which we can kind of almost guarantee will look identical to each other. But regardless, if you have kind of any lingering questions on the Mallinckrodt bankruptcy, this fact sheet is a really good one to check out. Next slide, please. Okay, allowable uses of funds. Next slide. So some of the questions we'll try to answer here. Excuse me. Are there requirements for how cities and counties can spend these funds? Hopefully we've answered that. What is a high impact abatement activity? And what happens if a city or county expends funds on an unallowable activity? Next slide. And I'm going to try turning my camera on again and see if it plays nice. So we put this slide in here kind of as a way to explain why these settlement agreements look the way they do and why there are these restrictions in place. And to the best of our knowledge, we can kind of take a look at the tobacco master settlement agreement from the 90s. Critics of this agreement basically said the revenue that was being made from these funds didn't typically go to what they were intended to prevent, which was smoking cessation. So a lot of states actually using those funds for general budget shortfalls or kind of a range of things that essentially weren't smoking cessation. So the funds that were supposed to go and help alleviate this issue that the nation was facing didn't actually go to those programs. Next slide. So with that knowledge, you can kind of understand how we went from having basically no requirements, no restrictions on the funds you receive as part of kind of a remediation program, and how we got a lot of restrictions and approved uses now in our opioid settlement agreements, hopefully to kind of alleviate that and ensure that the funds that are being received from these opioid defendants are being used to treat the very thing that we litigated them for, which was essentially fueling the opioid crisis. So opioid remediation is very clearly defined in these settlement agreements. It has three kind of core components. One is address the misuse and abuse of opioid products, treat or mitigate opioid use or related disorders, and mitigate other alleged effects of, including on those injured as a result of the opioid epidemic. Next slide. In addition to that definition for opioid remediation, I know I've mentioned Exhibit E a lot. It is the list of allowable uses, and it is effectively a list of what these funds can be spent on. So they are restricted for the California Abatement Accounts Fund. They are restricted to activities that can be found in Exhibit E. It's a decent sized document. It's not unreadable, but it is separated into kind of two different categories. So the first one is Schedule A, which are considered the core strategies. It appears that these are the strategies that were kind of pulled out specifically so that cities and counties in receipt of these funds can kind of target those. They seem to be kind of like the higher priority of activities. And then Schedule B is kind of a more comprehensive, all-inclusive list of approved uses. I will say if you are responsible for reporting your city or county's expenditures, we only include Schedule B for you to essentially choose from, just because we have found that Schedule A, those priorities can be found in Schedule B. So to kind of try and alleviate some redundancy, we only offer Schedule B for folks to choose from. And if you would like to view Exhibit E, we do have that linked on our allowable expenditures resource. It is also an appendix in each of the national settlement agreements. Next slide, please. Okay, California's high impact abatement activities. Um, I'm realizing we probably should have put this a little bit earlier with how much we talk about it. But it is um, it's not particularly tricky to kind of comprehend, but like when you get into like the reporting and actually like how to kind of think about the 50% requirement, it can get a little complicated. We're here to help. Reach out if you need any assistance. But basically for the abatement funds, which is again the largest share of funds that we have going to cities and counties, they are required to spend at least 50% of those abatement funds on what is designated as a high impact abatement activity. Let's go to the next slide so we can show. Yes. Okay. Here is the list of California's high impact abatement activities. There are 6. DHCS does have the ability to add to this list. We cannot remove from this list, but we can add to it. And that is exactly why we have number 6 right here, which is the purchase of naloxone for distribution and efforts to expand access to naloxone for opioid overdose reversals. I think we did this in our first year of kind of managing these funds. We put it out kind of for stakeholder feedback, and we overwhelmingly got a positive response saying, yes, we would like to add that to the list of high impact abatement activities. As a note, the state subdivision agreements do include this list, but some of the older ones that were kind of finalized before DHCS implemented number 6 will only include 1 through 5. But because we included number 6 as an high impact abatement activity, it's valid for all of the funds, regardless of which state subdivision agreement it does or does not appear in. Next slide, please. A little refresher on the California Subdivision Fund. So unlike the California Abatement Accounts Fund, this fund is not restricted to Exhibit E uses, but it is restricted to that definition of opioid remediation, which is a bit broader, but these funds still are intended to, abate the opioid crisis. So those in receipt of the California Subdivision Fund funds, they can use that money towards future opioid remediation. They can also reimburse the past opioid related expenses, which could be a past opioid remediation project, or it could be litigation fees that resulted from one of our opioid defendants, which are essentially our finalized agreements. So again, that list of Allergan, CVS, Walmart, Walgreens. And here's a little caveat that I mentioned before. If you do dedicate those funds to past opioid litigation costs, Brown Greer does have an additional reporting requirement. So it will also need to be reported to them in addition to DHCS during the reporting period. Next slide, please. Allowable expenditures. So we have a ton of resources on our webpage. If you are new, don't be overwhelmed by them. They are a wealth of knowledge that we have kind of gained over the last 5-6 years of managing these funds. So please check out those resources. They really are designed for folks that are new or need a refresher to handling these funds at the local level. You can see here it's very well laid out just on our webpage. So please go take a look. It'll be more valuable than the summaries I can give you. It will have more information that is pertinent for you to know. Next slide. Reporting requirements. I know everyone wants to talk about this. Next slide. So some of the questions we hope to answer now are, what are the reporting requirements for these funds, and how can I see how other cities and counties are spending their funds? Next slide. So here's just a little snapshot, kind of the timeframes we're working in. So we have our expenditure period, which is basically a state fiscal year. So it goes from July 1st to June 30th. And that's what we consider the expenditure period. That expenditure period is then whatever expenses were made or payments received during the reporting period. That's when you'll tell DHCS. And our reporting period, we are currently in one for state fiscal year 25-26, I believe. Our reporting period goes from July 1st to September 30th of each year. So that reporting period will essentially, as you enter or as we enter a new state fiscal year, basically we're collecting the data from the previous full state fiscal year. Next slide, please. And I've mentioned this before, but we do put together a fairly large annual report every year, basically compiling and aggregating and validating and visualizing all of the data we receive during the reporting period. We do have two of these reports currently available on our DHCS webpage. And I don't think I mentioned this, but we do also publish the city and county reports that we receive. Basically, once all of the data has kind of been collected off of those and put into our larger annual expenditures report, we do also publish those city and county reports. So if you're curious about your city or county, maybe you're not fully aware of like, how the previous fiscal years have gone, you can always look back and get a glimpse of what payments were received and what projects or activities were implemented during that state fiscal year. So they're all available for state fiscal year 22-23 and 23-24. We're currently working on our state fiscal year 24-25. We hope to have that ready to go. Our goal is always the end of the year, so late 2026. But if you are on our contact list, we do send out pretty frequent updates on when to expect that. When we do complete our annual reports, we do also host a meeting to kind of explain and walk everyone through the data we received and what we kind of think it kind of can show for trends and maybe for future expenses and kind of give a snapshot of where California is in terms of its expenses from opioid settlements. Next slide, please. So we do also have a whole page on reporting requirements on our California opioid settlements webpage. This is where you can go if you have any lingering questions on what to expect from that reporting period. If you haven't gone through it before, again, you can always reach out to our main inbox as well. Next slide. Resources. Yay. These are good. Next slide. So what are the best practices for allocating settlement funds? How do we request technical assistance? And where can I find additional opioid settlement resources? Next slide. Oh, thank you. So if you are new to managing your local settlement funds, you could be in receipt of a fairly large chunk of money, especially if no expenses have been made or only small fractions of those funds have been made, which is a really good opportunity for our local cities and counties to really think about how they want to invest those funds. But with that opportunity can come a lot of hesitancy, if that's a word, because, I spent this whole webinar basically talking about all of the restrictions and reporting requirements that are on these funds. But there are a lot of places that you can look to, right, that are effectively just foolproof, right? These are best practices that have been around since even before our opioid settlement funds. And on the next slide, we'll kind of show you where you can kind of who you can target and bring into these planning sessions. But really, if you look to evidence-based practices, and even better, if you can kind of correlate that to one of California's high impact abatement activity, you are going to have a very, very good project to implement. You can also supplement current successful efforts. So if you have a local harm reduction coalition, if you have community navigators, an opioid crisis response team, I would be very surprised if there was a city or county here that did not have something like that already operating. And so you can effectively take your opioid settlement funds and ask them what they need. I would guarantee that they've been doing this for quite a while. They have a really good idea of what is needed at your local level. So I would absolutely recommend kind of bringing them in, seeing what they need and how you can effectively supplement their current efforts. We also have a resource that's linked here that kind of goes into a little bit more on kind of how you can think about these settlement funds and where to properly place them in your community. Next slide. So I wanted to get to this slide because these are the folks down at the bottom that if you are struggling with how to invest your settlement funds, absolutely get into contact with these folks. They're the ones that will be able to guide you almost without fail. Um, so we have our county public health departments, county behavioral health departments. I really want to shout out our harm reduction programs and our syringe service programs. They're essentially our frontline folks that are working on this opioid crisis, and I can tell you they probably are always going to be thankful for additional funds for what they do. You likely have a local opioid coalition, maybe not at a city level potentially, but I would guess at the county level, local sub-treatment providers, and also our local hospitals and clinics. We've seen some kind of emergency room navigators being placed into these local hospitals. So there's a bunch of different folks you can tap into. You're not alone in trying to figure out where to put these opioid settlement funds, especially if you don't have a background in this. There are plenty of people that you can reach out that would be more than happy to guide you, including us. You can always reach out to DHCS. Next slide. More links. So these are our two bins. I've referenced them throughout the webinar. The first one is specific to the California Abatement Accounts Fund. So if you have questions on those high impact abatement activities or that 70% of funds for opioid remediation, go to these links. That's also where you can find our enclosure 1, which is our reasonable administrative cost policy. We also have enclosure 2, which is a glossary, which will probably also be very helpful if this is new to you. We tried to define some of the key words that we use and we see very often in these agreements. So we did our best to kind of compile them and offer up some hopefully helpful definitions for you. We also have a bin that is specific to our plaintiff subdivisions and their use of funds from the California Subdivision Fund. We also have a glossary included for that one. So if you're curious about, kind of the restrictions on the subdivision funds, this is where you'll want to head. Next slide, please. In addition to all of those resources, we do offer technical assistance to our participating subdivisions. We do have a technical assistance form. You can find that on our webpage. This is really specific to if you have a question on whether an activity or a proposed expense is allowable. You can kind of write a quick write-up of it, send it to DHCS using the instructions on that technical assistance form. Send it to us, we'll review it. It gets a lot of eyes on it, and we try to give you the best recommendation that we can based on kind of your written proposal. And feel free to do that. You can also, if you have general questions, maybe anything that I've discussed here, or just kind of a more general question that you don't see answered in our resources, you can send an email to our main inbox, which I think will be linked soon. Next slide. Here's where you can find those resources and more. I don't think we linked them all here, but we have some broad resources and some more specific resources. We have a pretty popular fact sheet that is specific to law enforcement and first responders. That one gets utilized quite a bit. So if you are someone who manages the opioid settlement funds for your city or county, and you're either at a police department or you are a police department that is getting funds, or any sort of law enforcement or first responder, I would absolutely recommend if you click anything on our page, please click that one first. We put a lot of work into that, and I would wager it would answer probably 95% of your questions if you are specific to law enforcement. We also have past webinar recordings on there. This one will also be uploaded there. You can take a look at those. We offer a few different types of webinars throughout the year. We have our annual report meeting, which was when we go over, kind of a smaller version of this webinar, but also the data that we have collected. The cadence for this OSF 101 webinar, we're thinking about twice a year, so that if anyone is coming in and is new or needs a refresher, you can join one of these webinars to kind of get the broad strokes over the opioid settlements. We also do host a reporting webinar that we try to plan pretty much right before our reporting period opens up. So we take you through the reporting form and any changes that we may have made since the previous year. So if you are involved in reporting, that is absolutely a good one to attend. And we should have our previous one recorded and uploaded by now on this webpage. Next slide. Okay, we made it to the Q&A, so I'll pass it back over to Chelsea.
Thanks, Jenny. We don't have too many questions in at the moment, so I'll start with a quick one. Jenny, if you can give a little bit of insight, if how can cities and counties find out if their planned activities are allowable? What would you recommend them to do if they are wondering about whether an activity they're planning to pursue is allowable? And additionally, in addition to the OSF inbox, is there someone cities and counties can come to if they have questions?
The answer to all of that is yes. So if you have a planned activity that you're kind of on the fence, whether it's allowable or not, you can fill out that technical assistance form, and it is linked through here. It's also available on our webpage. It basically will just ask you for a summary of that proposed activity, and then it gets sent to our team. And we will review it. It gets a lot of eyes on it. A lot of conversations go into it to make sure that we give you a very thoughtful response. So if you have an activity that you would like reviewed, even if you're just slightly unsure or you're totally unsure, like please, we encourage you to submit a technical assistance form so that we can review that activity and kind of give you the best feedback available. As for someone specific, excuse me, to reach out to, everyone here, assuming you're a city or county that is in receipt of opioid settlement funds, you do have an assigned analyst from DHCS. And so if you do not know who that is, maybe you're new and you haven't gone through a reporting period, you can reach out to the OSF inbox and we can link you up with that analyst. If you have done a reporting period and have been in contact with someone from DHCS, that's probably a good indication that they are your assigned analyst. I will say that when to decide which one to do, whether you want to submit a TA form or reach out to your analyst. If you have any sort of proposed activity, if that is the core of your question, please submit a TA form. They will be involved in the process of reviewing it. But we take those very seriously, and so they get a lot of eyes on them. So if you have a question about a proposed activity, use the TA form. It's just a good way for us to compile kind of a summary of your program before we start, actually giving you some feedback. Now, if you have general questions and you do have access to your assigned analyst, whether that's maybe a reporting question, how to categorize something, you're struggling with where this fits in Exhibit E, then you can kind of reach out to your analyst if it's a kind of a broader general question. I hope that helps.
Thanks, Jenny. Another question from Jesus Morales. He asks, how do you know if you received abatement or subdivision funds?
That's a great question. The easiest way is to go to our payment list that we have on our webpage, and it is, I think, frequently linked through this webinar. So go to that payment list, look for your city or county, and it will tell you all of the payments that have been received to date, and it will tell you what kind of payment it is, whether that's abatement or whether it's subdivision. So if you're only seeing abatement, good indication that you are likely not a plaintiff subdivision. If you are seeing both abatement and subdivision, good indication that you are a plaintiff subdivision, in case someone else had a similar question. But absolutely go to our payment list on our webpage. It'll tell you exactly how much a payment was, what type of payment it was, and what settlement it came from.
Another question comes from Susan Kelleher. She asks, when is the state fiscal year 25-26 expenditure reporting due?
I always mix up my fiscal year. So that's the current reporting fiscal year. So that will be due September 30th, 2026. So you've got about a month and some change.
Thanks, Jenny. And as a reminder, the webinar where DHCS provided the training on completing that, as well as resources related to how to complete the expenditure reporting, are all available on the DHCS website. Another question from Randall Rednar. He asks, can you describe the county revenue or funding projections for the next few years? Is there a revenue forecast? So I believe Brown Greer offers, it's not a guarantee, but sort of a projected funding stream resource. Jenny, do you want to provide some info about
Yeah, and if anyone from Aurora can quickly throw in that link, I believe we also have a link to these projections on our webpage. Apologies if I'm wrong. But yeah, Brown Greer does have kind of projected amounts. Um, it's hard to say for a specific county or a specific city. And there's a couple of reasons why. One is that the payments aren't always consistent. So you might receive a payment from Janssen that is, let's say, $1,000, and the next year, from Janssen, it's 5,000. Like it's hard to kind of say what the exact amount is going to be. There's also in terms of like Mallinckrodt, who was our bankruptcy, they on top of that bankrupted again. And so their payments ceased, which we were expecting more than just the two that we got, but effectively that kind of went void. We also have more settlements that are coming that may start payments this fiscal year. And if not this fiscal year, the next fiscal year. And we haven't seen any historical payments for them yet. So we can't really predict how close they're going to be in line with the projections. Again, those projections really are just taking the information available from those settlement agreements and kind of putting an allocation percentage to a full amount. And it's a lot of math, but a lot can happen during the course of these settlements. We've seen some settlements make early payments, right? I believe Distributor and Janssen basically, instead of waiting until a future year to make a payment, made a double payment. So it's kind of hard to predict based on these projections, but the closest you'll get is that projections website from Brown Greer, or you can kind of look at the historical amounts that you've received and see how close they are together. But right now, that's I think the closest that we can get.
a couple of questions about the Publicis settlement? Tony Wu asks, is the Publicis settlement new? And Marlena Safan asks, are there reporting requirements for Publicis and is there a spending deadline? So maybe just a little bit of, quelling any concerns for folks about Publicis since that one's a state only.
Yeah, so new is kind of a fun word. I don't know what like the parameters for new are. I believe we received our payment for Publicis in 24, 25. It might have been 23, 24, and I apologize, I don't remember, but it's not new. It's a few years old, I would say. It is one of our state's only payment. And I don't recall if it was a one-time only payment. I'm sorry, but that information is on our webpage, or if we expect additional payments from Publicis. If there are any payments being made to cities and counties and it says it's from Publicis, it's not DHCS won't have oversight over them, but if I recall correctly, that was one of our agreements that only resulted in payments being made to the state. Now, I'm going to caveat that by saying, like, if DHCS doesn't have oversight of a certain settlement, we're kind of in the dark on like how those payments are operating. So if Publicis does have some sort of settlement out there that is resulting in city and county payments to DHCS's knowledge, it is not under our purview, and therefore we're kind of unaware. But you can, like Chelsea said, rest assured that if you are receiving those payments, they don't have a reporting requirement to DHCS.
Another question comes from Valeria Rendon. She asks, do I reach out to our analyst if our Brown Greer total OSF amount is not matching the total OSF amount received? So discrepancies between their records and what Brown Greer is showing.
Um, I would have a follow-up question on if what you're looking at from Brown Greer, is it something you received in terms of actual payments? Or are you looking at the projected payments? Because it would not be concerning in the least if their projected payments don't match up to what DHCS has as actual payments. I will say our payment list that we have published, those numbers are given to us directly from Brown Greer. You know, we don't have another avenue of getting those numbers. They are directly from Brown Greer. So in terms of actual payment amounts, if that is what you did get from Brown Greer, but I'm going to assume it's projected amounts, they should be identical. The actual payment amounts. I think this is Valeria Rendon. Sorry, Chelsea, the chat went away. Can you read the follow-up she had? I think if I understood correctly, you said that you're looking at Brown Greer's total for actual payments, and then you're comparing it to DHCS's published webpage actual payments. If there is a discrepancy there, I would reach out to the main inbox, and if you have a link that you can provide or any document that maybe Brown Greer provided that shows actual payment amounts, send that to us so that we can basically go through what we have and see where that discrepancy is.
We're just about over time. I do want to acknowledge one other question that came in. This comes from Magdalena Moran. And she asks about why pharmacies are paying settlements instead of pharmaceutical companies. And she's also wondering if other states were equally affected by the opioid crisis and perhaps whether they're also receiving settlements. So anything to share there, Jenny?
Well, we do have pharmacies and pharmaceutical companies. It depends on what role they kind of had in the opioid crisis. Some of it is kind of unfair opioid marketing or dangerous opioid marketing. Some of it was irresponsible distribution methods of opioids. It just kind of depends, but we do have both. We've got the pharmaceutical manufacturers as well as pharmacies, as well as marketing companies. I mean, there's a whole slew of companies that have been litigated against successfully, resulting in these payments. So, I mean, to answer your question, it depends on what role they specifically had. And in terms of other states being effective, oh yeah, these are huge lawsuits at the national level. Most states litigated against these same companies, so that's why we have those two governing documents. So the national settlement agreements is with all of the states, the ones that litigated. I don't recall off the top of my head if any were omitted. But it was definitely a joint effort against these pharmaceutical companies and marketers and distributors. But what California did is we basically took that national settlement agreement and just made a more specific one, which is why we have our statewide, or I'm sorry, our state subdivision agreements. But to answer long story long, yes, other states were absolutely effective, and they are also in receipt of settlement funds.
Great. Thank you, Jenny. We're just a little over time and we've gotten through all of the questions. So I think we will wrap up for today. As a reminder, any questions that you may have, please submit to the DHCS opioid settlement team at osf@dhcs.ca.gov. And thank you all for joining today. Have a great rest of your day.
Thanks, everyone.